Dr. Steve Berry, current type 2 diabetes treatments are not effective. This is from the InsulinIQ.com premium course, Reversing Insulin Resistance in 90 Days.
Type 2 diabetes is one of the most common diseases I see as a physician as a result of insulin resistance. It encompasses and affects every single organ system. It's devastating because of type 2 diabetes. People lose their vision, they lose their kidney function, they have heart attacks, they have strokes, they have Alzheimer's, dementia. There's no part of their life that isn't affected. Financially, it's devastating. It is daily, weekly, monthly healthcare costs, visits to the doctor, all kinds of special equipment needed to accommodate their lifestyle as diabetes continues to decimate their quality of life. As a physician for the past 20 years, I've seen a tremendous increase and uptick in the amount of diagnoses I make of type 2 diabetes, which is directly related to an increase in insulin resistance in every way. This is a direct result of our entire culture being saturated with carbohydrates and being told that natural fats are not good for us and that we should avoid proteins. As people's body masses increase with fat, their insulin resistance increases dramatically, and type 2 diabetes is by far the most devastating of all the diseases that we see as an outcome of this poor nutritional standard that's been taught to each of us. Currently, the method of managing diabetes is to offer the patient more insulin in advanced stages. Well, the entire problem is that they're insulin resistant. As you give somebody who is already insulin resistant more insulin, it increases the problem of insulin resistance because they already have an excess of insulin. Does that make sense to you, to give somebody who already is resistant to insulin more insulin? This causes an increase of adipose deposition, which means they gain a greater percentage of body fat because insulin directly affects that. The higher their body fat, the more insulin resistant they become. If they're more insulin resistant, they require more insulin to keep their blood sugar at the same level, which creates more insulin resistance, which creates the need for more insulin. Can you see the problem with this current medical paradigm? This doesn't lead to any outlet, any freedom, any escape from this disease because it perpetuates the problem.
Dr. Berry says, type 2 diabetes is one of the most common diseases I see as a physician as a result of insulin resistance. It encompasses every organ system. It is devastating. Because of type 2 diabetes, people lose their vision and kidney function, have heart attacks, strokes, Alzheimer's disease, dementia. There is no part of their life that is not affected. Financially, it is devastating. Daily, weekly, monthly health care costs, visits to doctors, and all kinds of special equipment are needed. A large uptick in the number of diagnoses of type 2 diabetes, directly related to the increase in insulin resistance, is a result of our entire culture being saturated with carbs and being told that natural fats are not good for us. We should avoid proteins. The result, as the body mass increases, so does insulin resistance. Type 2 diabetes is by far the most devastating of all diseases as a result of the poor nutritional standards that have been taught to each of us. The current method of treatment is to offer the patient more insulin in advanced stages. But the entire problem is that they are insulin resistant. As they are given more insulin, it increases their insulin resistance, causes greater gain of body fat, causing more insulin resistance, requiring more insulin, and then more insulin, etc. Can you see the problem with this medical paradigm, asks Dr. Berry? It does not lead to any outlet, any freedom, any escape from this disease, because it perpetuates the problem.
Annotated, summarized, easy to share with loved ones.